People are not broken, they adapted to survive. Welcome to the Way Out of Childhood Trauma with Barb Wartzel-Smith. Welcome to our next episode of Way Out of Childhood Trauma. And here is with me an amazing person, Kiki Ypsilanti, which is dental surgeon, periodontist, but also RTT therapist from Cyprus. And I met her some time ago, and she's just so amazing. So I really wanted her to be the guest and share with us her experience, how the mind's working and how she's using it in her profession. Because she's very experienced in what she's doing over the last 19 years. She working, eliminating bacteria and healing the gums of people and helping the different tools and techniques to cure people from periodontal infections and gum diseases. So, and now she's certified rapid transformational therapist. And she make another type of surgeries. She eradicates invisible bacteria in our minds, deep inside in our psyche, and help them to live the life they deserve, free and happy. So tell me, Kiki, what is that? What lead you to start working with the mind of people, as a dental surgeon?
Well, first of all, a big greeting and hello from me also, Barb. Thank you so much for inviting me to your wonderful podcast. Thank you so much for your words, and I really share the same for you, and I appreciate you a lot, and you know that. So, first of all, I'm from Greece, but I live in Cyprus for the last 19 years. I have a family here, and I have two children too, two daughters. And as you said, I'm a dental surgeon with specialty in periodontics. I'm a periodontist. And the reason why I started studying and training and finally getting certified in rapid transformational therapy is because for so many years, I have been seeing patients of mine coming in my clinic with dental infections, with gum diseases, gingivitis, periodontitis, and I had treatments done on them.
Mm-hmm.
Some of them went great, some others, they needed more help.
Mm-hmm.
But what inspired me truly was that no matter how good I did the treatment,
Mm-hmm.
I could not help them deal with some other issues that in their turn could not let them heal properly, first of all, and then maintain the good results that we had after the initial treatment. So, for example, people were coming with lots of anxiety on the dental chair or with phobias. And let's start with the most classic one, the fear of the dentist.
Yeah.
Voila. Well, I didn't need any much of it. I mean, how many times could I see it? So many times, fear of the dentist. So I was like a monster in front of them. No matter how good I talked to them, how calm I was, how comfortably I made them feel, or how much trust I gained from them, the fear was not letting them just let me do my job properly, and also to make the follow-ups properly. And well, so stress, anxiety, and the fear of the dentist were the first reasons for me to start digging in more and wanting to find the root and the reason for these kind of issues, because they were impacting my dental profession.
Mm-hmm. Oh, I absolutely feel for that, because my son had the fear from the dentist after kind of butchered dentist when he was little. And then it was really hard to get him on the chair to just even open his mouth. But yeah, it's much better now. So
I'm sure
definitely. So is it just an effect of like anxiety and fear, or is it some deeper reasons you're seeing in reasons why people have like inflammation of gums or even these diseases, because we already spoke in some episodes about like link between mind and body and how many things can physically manifest. Do you see that any connection between what actually causing for people even like developing these issues that they need to go to?
Well, of course, there is a connection. Of course, there is. There is a very strong correlation between these kind of diseases, the gum diseases, and but not in an immediate way, in a secondary way. Meaning what? Well, all these diseases come from bacteria, and these bacteria, they come from the food, the drinks, the remnants, whatever stays in our mouth, and we are not getting rid of it properly and 100%. But what comes later, it's our immune system, which fights these bacteria, and the immune response, how strong is going to be, or exactly the opposite, how weak it's going to be too. And also, let's not forget that many people have also some other kind of medical issues and illnesses. And many of them are autoimmune, or some others, as they are called, chronic diseases. For example, also some heart diseases, diabetes, their stomach issues. And if you search behind all these issues too, there is a very strong connection, especially with the autoimmune diseases, as you already know, with our psyche and our mentality and our mindset. So there is a multiple connection, not just one way, multiple ways connection between the gum diseases, the response of the immune system of these patients, and also in correlation with the other medical issues that they have. So it's like you have this knot, this big knot, and you're trying to find a way just to unravel it, unfold it. So yes, of course they need treatment. Of course we do the surgeries. Of course I need to eliminate these bacteria, these physical bacteria from their mouths. Of course I have to teach them how to take care of their mouths and their oral hygiene every day. But the other things, which has to do with their mindset, with their psyche and their psychology, and how they respond, and with their thoughts and feelings, it's something that I could not do with my university degrees as a dental surgeon. And that's why I started doing it with RTT.
Oh, like for sure, we know that people, even like, people suffering with depression or feeling suppressed in their lives, their self-care, so self-love, is it not really leading to best care about themselves, including cleaning the teeth? And also, sometimes people grow up in an environment when they wasn't taught to, or they wasn't putting priority on their self-care. So I see a lot of people who just don't even almost know, or definitely don't have it ingrained as habit. So when people saying like, oh, it's the same as you clean your teeth every day, and they would say like, what? No, I'm not doing that, because they just grew up in an environment which didn't support that, or make it almost painful experience for them mentally to be forced to do things and stuff like that. So do you see that with your people you work with, how they getting to these situations? Like what do you see that it's that most common, I would say, denominator, like, or what is most common topic which coming up in a discussion with them, why they don't take care of themselves so well?
Yeah, so it's very interesting that you said that right now, because you really got it. I mean, you cannot imagine how big percentage of my patients, and I want to say something now about this, I have found that they come in my clinic having this deep, deep belief that they were not taking care of themselves for so long. So they had some other priorities, their children, their other family members, but they were the last ones. And there was nobody else there to take care of them. Not just when they were a child, just to show them how to brush, to take them to the dentist, or just to be involved in their lives. But even as adults, later on, of course, they continued the same way, believing that they're just not worth it. They're not worth it. They're not worth any treatments. Why should anybody care for them? So they don't care about themselves too. And I want to say something on that, especially women.
Okay.
A huge percentage of these people and of the patients that I've seen, unfortunately, this comes down to a gender differentiation. It's about women. Women that have put all their needs aside, all their priorities, their self-care for their family, for their children, for their relatives, or their family of origin, parents, for example. And they always tell me the same narrative. I have to do this because nobody else will. So what am I supposed to do? I have to do this. I have to take care of them. I mean, I'm obliged to. Okay, and then I ask them, so who is taking care of you? Where are you taking all this energy and all this power? Where are you taking it from, since you don't have it for your own self? And they just stay like that, and they just watch me. They don't have an answer, really. So how do you give when you're empty? How do you do that? And that's when they, how many times they just start crying on the dental chair when I tell them these things. So yeah, especially the last couple of years, and I've been doing this more intensely because I want to help them as much as possible. And they just burst into tears and just explode there. And some of them, they really understand, not under hypnosis. We're just talking, before we start the treatment, before I make the ejection. Well, another fear of ejections,
Yeah.
And they just burst. It's like finally they admit it to themselves, because they see that another person is seeing it, is realizing it. So they say, okay, so then I'm not crazy. So this stuff is real. It's true, but it's painful.
Yeah. Did you ever thought about like link between teeth as the tool of protection? Is it we bite when we fighting for our lives, and the lack of boundary, that lack of fighting for yourself in your clients, that willingness to just diminish own self for others?
I believe there is a link, as you said it, and it can be expressed most of the times with teeth grinding, with bruxism. Well, maybe for your listeners, if they don't know what that means, teeth grinding, it's exactly that. When you grind your teeth together and they make noise, and you do that unconsciously, especially when you sleep, during your night sleep, and you cannot realize that you're doing it because you're asleep. But if you have a partner, your partner can hear you doing that. And another way, which is most common, is the bruxism phase, is the tightening of the jaws. And you do that also during the night sleep. Many, many people do this, and they don't know that they do it. And even I have been doing it. Okay. So you cannot realize that you're doing it unless you experience some symptoms. And it's what you said, boundaries. They cannot put their boundaries during their life in their daytime in their everyday lives, and they just put it when they are alone and when they relax, when they sleep. But the force is so much, or the anger, the this overwhelming of emotions that they are not able, or they think they're not able to express when they are awake. And they do this at night. And then they wake up with horrible migraines. They don't know why they have these migraines. They cannot open their mouths. They have muscle pain here and also here and also at the back of the neck.
Okay.
And they go to other doctors trying to find the solution and the answer. Why do they have this? They even have head scans with no reason. And I just tell them, after you take a good history and you ask them the right appropriate questions, that it's not that. It's this. Your teeth are expressing themselves during your night sleep, because you cannot do this while you are awake. So it's like it's kind of the both sides, both ways. You're not expressing yourself during the day, and during the night, you also experience that by putting all this huge force between your teeth. You can break your teeth with this force. We have huge force in our jaws. We're like crocodiles. There is a huge force there, believe me.
Yeah.
Okay. And the other way is that it's like you experience this maybe anger and this need to express yourself, to open up your voice, to speak up, to stand up for yourself, but you're not doing this in the day with others. And in the night, you do exactly the opposite. It's like self-punishment, kind of. And also, it's the anger, it's the anguish, it's the stress, and it all comes down to how you live your life during everyday life, during your days.
That's really interesting, this like thinking how actually we feel, and I think that a lot of people don't really realize that, is it? I had a lot of people having migraines or issues with the teeth, and don't people don't realize how much it's actually reflecting their daily life, that it's not about just about like how much sugar they eat and if they clean their teeth, but all about their mindset and how they actually living in the life. And it's starting with the children, is it, like how the children are allowed, and then that. So you see it in the children also, or what is your experience as the child, like how you do relate to the people which have these issues?
So I don't see children as patients in my specialty, but I know many children are experiencing this. So of course it's the same explanation, the same way with children. And with children, I'm sure it's much easier to find it because they're more open. And of course, if you don't deal with it, this can go on when they get older and they grow up. So the sooner the better. You find the reason and you stop it. But when you have adults and they come into your office, into your clinic, and you find all these issues, you cannot imagine all of these things, all of these problems and things that they find as problems in their lives. They all come down to their childhood every time. So when I talk to them before we begin anything, or when we finish the treatment, really, it's like I can see their pain as if I have children in front of me, and they just want to talk to somebody that will listen to them, somebody that they never had when they were younger, and they had never the support that they needed as children. And It's amazing when I witness that.
Yeah.
And I can see so many responses from people when they are in these kind of situations. And, you know, it all comes down to my decision and my determination to help not just my patients, but everyone who will come to me and help them deal with all these deeper, let's say, kind of germs.
Yeah. Yeah, and that's amazing. And I think that it's important for parents who maybe experience it themselves, not to focus just like, okay, I realize that I have the issue with the teeth, I work with that, and so now I will be like harsh on my children to brush their teeth, but really focus on overall well-being. Is it's not really just about that. Of course, self-care and taking care of all parts of our body, including our teeth, is really important. But that self-love needs to be built from that feeling that I am worthy, that I am enough, that I am loved and needed. And so the force is not work there, is it is more leading to rebellion and or abandon the habit as soon as possible. So, and also, did you face it like I heard that some people like overdoing it, like that they cleaning like too much. What you
Yeah,
would
of
say about
course.
that? It's from your
Yeah.
point of view as specialist.
Well, this is exactly the opposite. You know, we have one point here and the other one exactly from to the opposite direction. So this reminds of, you know, something obsessive compulsive disorder.
Mm-hmm.
And yeah, it comes to that. So this relates to something also deeper, something much different than what the reality seems outside. So what we do, we dig into it and we find the deep root cause of it.
Mm-hmm.
I want to say something about the children that you said
Yeah.
before, because I think it's very important and it's crucial for parents to know, since we've been talking about the dentistry. To all the parents, please do not take your children to the dentist when you have a treatment to be done in your mouth, but you are so scared and so afraid, and you have your little children or even adolescents with you in the same room, watching you and witnessing your fear. Because as you know, Barb, this is a blueprint that immediately is transmitted to them, and it expresses tenfold bigger when they will grow up. And for what? For no reason. So never take your children with you. If you know that you have a fear, well, first of all, you have to deal with it as an adult.
Yeah.
Because nobody's meant to live with fears of any kind. So deal with it. And then after, when you deal with it, show to your children that, look at me, it's normal. It's safe to go to the dentist. Look, I sit on the chair. I listen to my doctor. I do exactly what she says. I feel comfortable. I know this is for my own health and well-being. And I do this to protect and to take my self-care. So I nourish myself. I protect myself. And that's how you're going to do it by yourself. You don't have to tell them anything. They just watch you. They witness you. So it's not what you say here, and you know that, Barb. It's what they experience from the parents. Because I see this so many times. And, you know, when I said to some parents, when I see it happening to other colleagues, and I try to explain to them politely that it's not a good idea if you're screaming and shouting and you're so anxious on the dental chair to have your child next to you watching all this stuff. It's better to leave the child outside or never bring it with you. And some of them understand that and appreciate it. Some others don't. So it's really a shame to see this kind of stuff. So this is a good advice, I think, for all the parents.
No, I think that is amazing advice, and I think that it's actually going to that if we would have car accident, we would hope that child will not be there, is it? We would
exactly.
hope that child would not witness that what's happening there. We would not take the child to the any other surgery? Is it like we would not make the child watching the open heart surgery or fixing up the bones? And it's the same, and it's exactly about that. I know people who say, oh, I am anxious because everybody in our family is anxious, because my mom is anxious and stuff like that. It's normal for us, but it's not. It's just learned behavior. It's just because they watch the parents do it. And it's in that a lot of people don't realize really how their behavior affecting their children, how they molding that beliefs and the reactions of the children. And watching the parents suffer in any way doesn't make child stronger. That's like that's a myth which I would like to really people forgot. It's not make your child stronger. If the child seems to be stronger, it's just because they start numbing their feelings and they just put on the resilience as the fifth trauma response, like I will just ignore it and I will do. But that means that they never really working with their own feelings after that. So yeah, I'm really glad for this advice that people should take the dentistry same way as any other things and realize that it's their responsibility not to pass on that fear to their children, an opposite way to teach them that it's okay and deal with that fear. So you mentioned when you speak with your other colleagues, how you feel the medical society, especially in dentistry, taking up on working with the mind and working with the fears and phobias and helping people at least in that way that they would not be afraid of the dentist. What do you feel the reaction is in the medical field?
That's such a good question. It's so interesting. Thank you for asking that because it's multidimensional. Let me tell you why. Well, first of all, because there is not any university in the world, medical school or dental school, that teaches us about the mind or about our mental health. Not just for our patients, but for ourselves first and most. Okay. So we never had any lessons. At least me, I didn't have any lessons about this field. So, as it is expected, many medical and dental professionals, they don't rely and they don't believe so much about the power of the mind and how important our mental health and mental and emotional well-being is, and how it affects our physical body too, in all its aspects. And I can get it. I understand that to be true, because what we are learning in our studies is this is what's happening, that's the proof. So you have a proof there. So this has this study and the other study and the other study, so you can prove this. And for some reasons, maybe obvious or not so obvious, the medical society has not taught us that, with your mind, you can do many, many things that we cannot do with our medications and with big, field of industry with medications. And so many, many, many other colleagues of mine, they see this with hesitation. So they say, okay, maybe, or maybe they will say, no, this is crazy stuff. This is woo-woo stuff. This is, who believes in this stuff? I mean, it's just black or white, okay? They don't see anything in the middle. So if I see this, it exists. If I don't see it, it means it doesn't exist. And it's fine. It's okay. But some others, so it depends on the person and his or her personal growth, Barb. His or her personal experience, traumas, and how much work this person has done for his or her own self. So it all comes down to that. So it's fine if they don't believe, many of them, to the power of the mind and our psyche. Some others I see, but they hesitate. They're not so easily open and express themselves saying, yeah, that's what's happening. I've seen studies on that, because there are studies, as we know, okay? There are universities in the world that they're occupied all the time with this kind of studies, with the scanning of the brain and what's happening when you're under hypnosis, and the immediate shift that is taking place, and all these incredible and wonderful things that anybody can find. But they don't express themselves, these colleagues. So when I talk to some of them and I share some experience about the RTT, for example, I can see the reactions. Some of them, they're so skeptical, or, they see, I don't, it doesn't resonate with me so much. Okay. And some others, they are, eyes and ears wide open, and they want to learn. They want to hear what you're saying. And you can feel immediately that this is something that it's calling them. Yeah. So you can realize their personal growth from these things, and I'm so happy to see that gradually this thing is changing, because that's what was happening in the past. But I don't think it will stay for long in the future. This keeps changing, because personal growth is taking a huge residence now in our mindsets. And because we can see that no matter what is your profession, no matter how big house you have, or how good car you have, or how much money you earn, or what a wonderful family you show to the other people that you have, or what good parties you attend, and you're invited to so many celebrations, okay? It doesn't matter. If you're not happy in here, if you're not self-fulfilled and self-aware, it doesn't really matter. So it all comes down to that. And especially we as medical and dental providers, if we are not good, if we don't feel good enough for ourselves inside, how are we supposed to offer our services to help other people? How are we doing that? We cannot. And then we suffer from anxiety, from depression. How big percentage of doctors have depression, and they are suicidal. So is that really healthy? Is it really healthy to make other people healthy, but you yourself are not? I don't think so.
I absolutely agree with you, and I think that the wave of shift is coming. It doesn't have to be tsunami to destroy everything what we already know, but I think that the change is necessary. And I think that if people start seeing how it's making their life easier, like even like if you, an easy way, if the patient is not anxious, you probably spend less time with them on chair. If they are able to follow their instructions, they will not need to come again. And I think that it's not about losing any jobs, because there is so many people who needs to be helped anyway. So yeah, so that was really interesting. And so Kiki, tell me, if somebody will want to contact you and work you, maybe have this topic and think like, oh, maybe this person would actually understand, because it's kind of that great combination of that I have maybe some issues with bruxism, or have issues with the teeth, or overall feel like that you are the person they would feel that can speak with or work with on their mental health. What is the best way to contact you, and who is those people who you think that should contact you?
Well, everybody can find me now in my new website, which is my name exactly as you see it, kikiypsilanti.com. And well, this is the easiest way where you can contact me. And of course, there is the email, contact@kikiypsilanti.com. again. So it's my name, as you
Yes.
see.
Oh, that's
Simple as that. Yeah,
simple.
it's just
Don't worry. It will be in
my
the
name. Yeah.
link. Link will be in
and
the description. Yeah.
and anybody can come, whoever wants to, whoever decides, not just for the dental health, but for the mental health, for the emotional health, for the psychological health, all these things, because as we know, all these are related, all these are connected, everything, physical, emotional, mental, all it's one. We're all one, all one. There's not any separation.
Oh, that's yeah.
So yeah, you can find me like that. Easy.
Absolutely. That's amazing. So I have the question which I ask every guest in the end. What would be the one last tip or advice you would give our people who listen or watching us? Um, the one last kind of message. What do you would give some message or tip to people?
Generally speaking?
Those who
Okay, so not dental advice. I gave one before, okay? So
yes.
let's focus to something else then. Okay. Uh, trust this little voice that you have. You all have it. You all have a small voice. It's not loud. It's small, but it keeps speaking to you. But you ignore it. You dismiss it. It's scary to listen to it because maybe it is telling you something that you don't want to hear or you're not ready to acknowledge, but it's there. And the more you push it down, the louder it becomes. And the louder it becomes, the more distraction you decide to have. So you may be more addicted to something, or you may increase the volume of your life events, everyday events, so that you're not able to hear this voice. This voice needs to be heard, and this is called your intuition. This is not the mind, this is the soul speaking to you. And especially nowadays, I witness more and more people having this voice and being afraid to hear it and listen to it. And I tell them to trust it because it's them talking to them. So it's not the mind as we know it, as this beautiful, wonderful brain with all these neural connections and pathways. It's really magical. It's a tool that we have. But unfortunately, it's conditioned to some beliefs and some programming that's not ours. It never was. So whenever you have this little tiny voice inside of you, just give it some time. Just be curious about it. Just listen to it. Just see what it has to say. And just be curious and say, okay, so why? And it's mostly as a feeling. It's not something, a mental procedure that you follow to listen to it. It's just a feeling. It's just a knowingness. And it's very subtle in the beginning. This voice is protecting you. This voice is telling you the truth. No matter how hard it is, how cruel it may seem, how uncomfortable it may be and scary, and it will keep knocking on your door until you hear it. So if you don't think you're able to hear it or you're too afraid of it, there are some wonderful ways like RTT, like rapid transformational therapy, and you can deal with these things that they don't let you hear this voice. Just listen to your voice. That's it.
Thank you. That was amazing. That was really great advice for everybody. I hope that everybody will follow this advice to listen to their own intuition. And yes, if you struggle with that, or if you have feeling that it's too loud, that is the options. You can contact the Kiki and get the help, or you can contact me. and or many other people around the world who helping same as we do to help people to recovery from whatever happened to them. The topic of our podcast, the way out of childhood trauma, but it's about that it's very wide area. It's all that what happening to us as children and molding our adult life. So if it's like witnessing the mom screaming on the dental chair, that's a one of childhood trauma, and we can deal with that. So thank you very much, Kiki, to come to be guest.
Thank you too.
And for those who want to follow us, please follow us on any media you listen to us, if it's Spotify, Apple Podcast, Podchaser, or Podbeans, or if you're watching on us on the YouTube, share, like, so you will not miss next episode. And thank you for listening to us. Bye.
Thank you. Bye-bye.
Thank you for listening to Way Out of Childhood Trauma. If today's episode resonates with you, visit your steps to explore resources, training, and support designed to help you understand trauma, reconnect with your inner strengths, and rewrite your story. Until next time, take your next step